You're listening to The Sister Strain, with another round of our Care to Share series, leading to the screening of our upcoming documentary, The Coalition, on May 16th. We're going to dive a little deeper with 5 of Chatham-Kent's anti-human trafficking coalition members. Each will share about the service organization they operate here in CK, the ways in which they are seeing gender-based violence and human trafficking play out in our community, and the resources they offer survivors of these crimes. Now, a few of these ladies will have an extra bonus as they interviewed with us on topics for our other films, Unhoused, Communities in Crisis, and This Women's Work. So you'll be hearing about how their work is affected by the housing crisis and also their thoughts and experiences as women in the working world. We left that all in because extra information is always a good thing. The only way we can create lasting change is by uniting together and becoming informed. So follow along and, of course, care to share.
My name is Tara Greenway. I'm the sexual assault domestic violence team lead here at the Chatham-Kent Health Alliance. I've been doing this job now for about 8 years. Prior to that, I was an emerge nurse, and I've worked all over through the hospital and been nursing now for 26 years. I am married and have 3 sons and now have 7 grandchildren. I am involved a lot in the community, so I am the chair of the Chatham-Kent Anti-Human Trafficking Coalition. But I'm also part of the Chatham-Kent Coordinating Committee to End Violence Against Women. I also sit on a youth and partner violence table. All of those are sort of community outreach that we do. As well as that, I'm also involved now with the regional committee for reviewing cases. So those are cases that have not gone to court, have been thrown out of court. So we get to sit and kind of review them, and that involves watching, like, we hear from the 911 call to the police statement, and then we get to listen to the police interview, and then decide whether amongst a group of other organizations on whether we felt that maybe that should go back to court, or if there's a way that they could have improved somehow in helping that victim. What else? Are there things I'm trying to think of that I...
Is there more?
That's already a lot.
Number 1 is always my family. That's, my biggest, I could say that's my biggest accomplishment, and the thing I'm most proud about is my husband and my kids. So
obviously being a nurse for so long, like, you were drawn to being in the healthcare field. Did you ever imagine you'd find yourself in this type of position and being on these boards? Like, how did you find yourself here?
Never in a million billion years did I ever think that I would be in this position. So I started out as an RPN in 1995, and I worked at the Chatham-Kent Retirement Center. And then I came to St. Joe's Hospital, where I worked there on the continuing care floor, where I worked with your mom. And then I decided that I wanted more, so we went back to school. I upgraded to get my degree in nursing, so then I got my bachelor's of nursing and started working in Emerge. And then this position became available, and our manager at the time was Natalie Clark. She's now our director. But I had called her, or she had called me, I think, and she was telling me a little bit about the position. And then I asked her more about it, and she let me talk to the person that had the position prior to me. And I thought, well, I went back to school for something different, so I'll give it a try. And at first it was way out of my realm of what I was used to doing, because we were doing policies and procedures and a lot of paperwork. And then I went to Toronto to get my SANE training done and started working more one-on-one with clients. And just as the years went on, I became more passionate about the work I do. And I know we had talked before, and I said I was never what you would call a feminist, because I always thought that was sort of looked at negatively. But now I could say, and my husband could definitely say, that I've become much more of a feminist in a positive way. Like, not to say all men are bad. We know there's lots and lots of good men out there, but it's just you kind of see in this position more of the way women are sort of less than or put down more. It gives you a different perspective, I guess you could say. And I had no idea prior to doing this, which is why I think the work that you are doing is so important on getting the word out, because I didn't know that all of this existed in Chatham-Kent, the number of assaults that we're seeing, and sexual assault, domestic violence, human trafficking has become very big. I was totally oblivious and unaware of all of that violence that was here in our community. So it's really taught me a lot.
I think that's the big thing for these projects. I think a lot of people aren't aware of what's happening right in their own community because we don't talk about it often. So
Right.
it's good to share.
It is, and I think that's kind of a way. And I think on a prevention perspective, I always talk about this, and sometimes people agree, some people don't. But even when we think about, as angry as we get with the men and their behaviors, because a lot of it is gender-based violence. 90% of the victims we see in this at the Chatham-Kent Health Alliance are women, or female. But we want to, like, we look at them to blame them, but then when you think about it, what has made them come to that point of violence? Like, what's happened in their lives, or what have they not been educated on, or have they ever been educated? And not necessarily does every person have a good role model in their family. I think their families are a lot more broken nowadays. And by broken, I don't mean divorced couples. I mean poverty and drug addictions and things like that. And I think a lot of kids, unfortunately, are growing up in homes like that, where their safe place is the school. And I think that's why we saw a decrease during COVID of sexual assault, domestic violence, was because those people were now stuck in that environment and unable to get out. But that's just my opinion, I guess.
Absolutely. No, it's what you say. We're working on a project about it too, about that. It has to be, it's a societal thing and it affects everyone. And if we have a problem with the male-female divide, we have to look at what needs to be done to work with the men and to advocate on behalf of them to make sure that everyone's aware of where the changes need to
Girls
happen.
have been being taught for a couple decades now, like, you don't have to follow the system. Go out, be the boss, be the leader, change it, stand up for yourself, do this, break out of the mold, right?
Yeah.
But no one's been telling little boys, hey, you know what? This system isn't great. You could do things differently. You can be emotional. You can ask for help. You can let people know when you're hurting, when you're scared, when you need help.
Very true. Yeah, because it's just
telling them.
No.
And then we wonder how we're here.
Right. And no one talks, well, not always anyway, but not a lot of people talk about consent, what consent is, because we often assume people know that, but they don't without being told, or not even just consent, but what intimacy and what healthy relationships look like. Like, I think, especially if they're being raised in a relationship, like in a family that maybe there isn't a good relationship. There's a lot of fighting and going on, and they think that's normal. And cultural also has come into this as well. We see different cultures and immigration coming in where it is their culture that they are like, to give an example, I don't like putting a certain culture on the spot, but where a woman is treated as less than, not able to make decisions for herself, that the man is the head of the house, the man is everything. He makes all the decisions. They're not often allowed out to work. They have to cover themselves. Things like and if they don't listen, then it becomes violent. And because it's being taught to them by their generations and generations, they only know that is truth, so they believe that, and they don't believe there's any help out there for them. So another part where I think we could do better at is with immigration, all immigration, women and men included, is educate them when they come into Canada to say, this is our law and this is what this looks like in Canada, and women are equals, and they do get to go out and they get to work and they get to improve themselves and get education, and their voice can be heard. So, but be a lot of different things.
Yeah.
Well, I'm just thinking, obviously, it's so great being in a position like this, knowing that you're someone who's passionate about it, because I'm like, this wouldn't be an ideal situation. Meeting these people in one of the worst moments of their life, if not the worst moment of their life. So, like, how do you stay passionate about the job? Like, what makes you keep going? What makes you want to keep getting up every day and doing this work?
I think part of it is honestly the collaboration. Like, because what was happening before we had all these tables and before we knew our community partners, when I first started in this group, you felt helpless because you're trying to help this woman who has nowhere to go, like it's completely unsafe. Nobody's listening. You call, and don't get me wrong, victim services is amazing, but when you call at 3 o'clock in the morning, the best case scenario is a hotel that's not safe, that they've probably already been violated in, and that is where we send them. Or like, so I feel like the collaboration with community partners is key. I hope every organization is doing it, because I wouldn't be able to do the work I do without them. So now I know I can call up the women's shelter and say, I have a client here, this is the situation, can we help them out? And Karen will go above and beyond to get those people into the residence or a safe place. And same with Sarah St. Pierre, Kate Verno at Victim Services, they will try their best to get them somewhere safe. And then if need be, provide further wraparound services. We got Family Services Kent House of Soffer Scene for addictions. Like, I think knowing all those different community partners really helps, because for us initially we do have to be that person, the soft person for them to land, and we do the medical and we do the forensics and all of that stuff. We offer supports. We do have a counselor here on site now too, that's trained for EDMR training for trauma informed patients, that they can see as well, but they have to be adult age to see her. But we do have other supports. I guess what I'm trying to say, all in all, is we're a small piece of helping that victim or survivor, and the rest is we rely on community to help with the rest. The Sexual Assault Crisis Center, another great place to refer patients to get that healing.
Absolutely.
Beautiful, absolutely. That's you just answered one of the other
I know,
questions. We
yeah.
talked about the importance of collaboration and communication to build better communities that we see often in
Yes.
Chatham, and we've witnessed a lot. So
And all that.
Yeah.
Yeah, we keep saying this, so like a lot of mini matriarchies around town of we're seeing, I can't say there's no men, we're not interviewing men, but we're seeing a lot of women in very important positions dropping their egos and their pride of what their job is and what they do, and coming together to form these coalitions and these boards to say, how do we work together to share and amplify our resources to create bigger change?
Yes, because I think we always worked in silos before. It was almost competitive, where it was, I could think of one organization in particular that always wanted to, no, it's this way and this is the way we're running things. But now it seems like we've all come around and we're like, okay, I could do this to help this person. I could do this to help. Like, we're together on it. We can't do anything alone. So that was, I think, honestly, the movement though of that was COVID. If anything positive came out of COVID, it was like now having to do Zoom meetings and putting a face to that name and getting to know your community partners was a big thing. And again, I think what COVID also changed, unfortunately, though, was the increase of violence has now come out. So now since 2022, we've doubled our numbers. I still think we have to do better. I think that we're only still seeing a third of what's out there and what's happening. I know I've talked to other partners, like other units of the hospital that had no idea that, oh, okay, I didn't know that their patient would be brought right into the emergency room. They didn't have to wait out in the waiting room and be treated poorly possibly, or be waiting for 8 hours to come in and see somebody. So also when we talk about community, it's, I guess, each of us as an organization going out and educating the public on what it is we do and how we can help them. Because I think there's a lot of myths out there. I know, like, another myth, a certain individual that was a young teenage person that was referred to us by the emergency department, and she didn't come to us because she thought we were going to call her mom. And we don't do that. We don't call her, and we don't call the police, and we don't involve people that they don't want involved. It's very private, and we can help victims and meet them where they're at and what they want. And a lot of people say, like, I had a person that before that asked me to write a letter to the newspaper about telling their story and how it could help other people. But at the same time, in my letter, I had said that I don't feel that that's everybody's healing. Like, everybody's healing is different. And sometimes by telling their story, that could be more victimizing than it can be healing. Just like going to court. For some people, that could be very healing because somebody's believed them finally. Whereas other people could go the opposite way and they feel terrible after. So it's just giving everybody their choice and the power back, I think.
Yeah, Absolutely.
Yeah.
You've talked a little bit on it, but could you walk us through, in terms of the resource that's here in the community, could you talk us through if someone is requiring the services, what
the process is
like? What the process is like.
Okay.
Sort of take us through step by step. If I was someone acquiring services here, I was a victim seeking out help at the hospital, what would the process be?
So I'll give a scenario of 3:00 in the morning, because typically, these things happen when we don't want them to happen. So if at 3:00 in the morning a patient was sexually assaulted, or involved in a domestic, trying to escape, or trafficking, and they come to the hospital, they would have to speak to, unfortunately, the registration clerk first. I always say to people, though, if you don't want to say out loud why you're there, just write it on a piece of paper, slide it under, and the registration clerks are awesome. They will know, like, okay, that's the next person to come in. So even if there's 10 people waiting to be seen, they know that person needs to come back immediately. The triage nurse will then talk to them briefly. If there's an acute injury, so if they have like a gash to the head or something that's obvious, they will have to have them seen in the emergency department first, but never are placed in the waiting room. So if they're brought back and they're seen by the emergency physician, once they're medically cleared, they'll call the SADV nurse in. So the SADV nurses are all on call 24/7, myself included, and we come in, meet the patient, and we talk to them for a little bit first, just to see what has happened, what's occurred, and then we give them options of care. So those options, if it's a sexual assault, those could include a sexual assault evidence kit up to 12 days post-assault. That's another misconception, is sometimes people don't know when the timeline is. So it is believed that semen can stay inside the vaginal canal for up to 12 days after. So we are able to collect samples up to that point. With prepubescent children, pediatric patients under the age of 12, we only have 72 hours to collect, and that's because they're smaller, so a smaller timeline. With pediatric patients as well, another thing to know if they were to come in was the SADV nurse would call the pediatrician when she gets here. So she'll go in, she'll talk to the family, get a brief history or synopsis of what has happened, call the pediatrician will come in, and they'll do kind of a head to toe assessment together. Sometimes photographs are taken of the child's genital area, and the reason for that is so that we can, if we're not sure, if we see like a notch in the hymen, which I always say hymen and then forget some people aren't medical. So hymen is that extra layer of skin around the vaginal opening, and everyone's hymen's different, and everyone's like you can injure a hymen by like riding a bicycle and falling down, so it's really hard to determine if an injury has occurred or not in a child. But if there's like a difference that we see, or maybe a scar in the posterior fourchette, we want to photograph that so that we can send it to sick kids. And sick kids hospitals, they're experts at looking at that and try to determine if it is an injury or if it's just a normal finding. We do try not to be invasive on children. We do not like doing sexual assault evidence kits on children, but if there's strong evidence that suggests the child was sexually assaulted, then we will do them. If it's an adolescent or adult, and when I say adolescent, usually around 12 years or older, or 13 or older, because typically when a 13-year-old comes in to see us, they don't want to involve a pediatrician, so we'll just take care of them ourselves. And the same thing, we offer them STD testing, prophylaxis for STDs. Usually that's another thing that people don't think about when they're sexually assaulted is, oh, great, now I also have to worry about contracting an STD. So we are lucky here that we work under medical directives and we can provide that medication for them right away. We have up to 72 hours to provide them with HIV PEP, which is prophylaxis, so it reduces their risk of getting HIV. So if the person that assaulted them, if they're known to the person, they might know whether they're an IV drug user, if they've been in jail, if they have men who have sex with men, puts them at higher risk of having HIV, so that would put the person at higher risk of contracting it, so we would provide that medication for them. We will offer them photographs of any injuries other than, we will never photograph genitals on an adult. But any injuries that we do see, we could photograph, and we could do a sexual assault evidence kit. Oftentimes when they come in to see us, they're very distraught, very traumatized, so they don't know if they want a kit done or not. So what we could do for them is do the kit, and hold it here for up to a year. Well, I have to say there's some that I keep them as long as I can. The only reason we get rid of the kits is when our cupboard is overflowing and we just don't have storage anymore, and then we destroy the kits, unfortunately. But we will keep them as long as we can, so that gives them an opportunity to decide if they want to pursue the legal system. Sometimes after a while of talking, maybe some counseling, they might decide that, yes, I want to do this. Or if they find out their friend maybe was assaulted by the same person, then they might do that. We provide them with lots of referrals to community partners, and then we do follow-up care for them. So another important thing, especially with staff, when they come in, they know people here, like they know, and this is such a private thing that they don't want anyone knowing. So when they come in, we're lucky here as well at Chatham Hospital that we're able to put a lockbox on their chart, and we do that for every victim. But if it's a person specifically that works in the hospital that's requesting us to, because they don't want people to know, I could physically walk that chart downstairs and they'll lock it up right then. I won't even have access to it to find out the results afterwards. We have to get permission to have it unlocked, to look at the results, and then call them for follow-up. So again, we would do that, and then book follow-up appointments with them if they're willing to do that. And then I have myself, I'm able to, if there was a person that maybe wanted assistance providing a statement for police or anything like that, I could help them with that as well. So that's the case. I guess that would be the case scenario for somebody out in the community that was coming in at 3 o'clock in the morning. If it's daytime, Monday to Friday, 8 to 4, and I'm here, usually people will contact me and say, we've got a patient here, can you come see them? And then we can avoid emerge altogether. Again, and another nice thing with our treatment center here in Chatham, just recently that changed, is one of our SADV nurses graduated and became a nurse practitioner. So she asked if she could stay on as an SADV nurse practitioner. And because she works upstairs Monday to Friday, 7 to 3, they said, well, if you want to see a client that Tara has, yes, absolutely. So now what that's done for us is it really avoids the emergency department. So even if they had an acute injury where they needed a CT scan, Amy can order that for them, and then she can read the results back to them, and we can provide them with more holistic care where they don't have to be involved with the emergency department at all. If they're an inpatient, so if they're already a patient in the hospital, they will contact admitting, and admitting will usually contact me and say, we have a patient here that needs to be seen, and I could go to them. We also serve Wallaceburg Hospital, but we can't see pediatrics in Wallaceburg because there's no pediatricians that go out there. So pediatrics come here, but we'll see anyone else out there. I will sometimes also, one thing that's easier, I guess, I love to be more mobile. I wish that we had a system that we could go to communities, so therefore like Walpole Island or go to Moraviantown and bring our kits with us. We don't have that in place, but I can go over to the Women's Center and treat the patient there. If it's just photographs and injuries or even like small wounds or something like that, I could do that at the Women's Center. But I would love to travel more to other places. And domestic violence is fairly easy to do that, but with a sexual assault kit, it's a whole different ballgame because you're collecting blood and urine and swabs, and they have to be cared for, and orders put in a computer, that kind of thing. So that's where it becomes a little bit more difficult. That kind of something.
Yes, plenty. I was going to ask more so in line with human trafficking. We've talked about how we're seeing it more, and previously in a conversation, imagine we haven't spoken about this. You had told us about some of the indications of things you've seen around here that make your radar go off to say, I think this is human trafficking. Could you tell us some of those things?
Yep. Yeah, definitely. So one thing is, the good thing about COVID was the trafficker couldn't come in, but now visitors are allowed in. So one thing that alerts me for domestic violence as well is when the man doesn't allow her to come in by herself. So he's standing there and sometimes we'll talk on her behalf, that kind of thing. What we try to do in that situation is tell them that we have to see them alone for a minute, like we have to take them to the bathroom or do something like that. And then in the bathroom, we do have signs up there with a red marker. If they put a red marker on their urine cup, then that would indicate to us that we have to speak to that patient privately. And there's various ways we could get away with doing that by saying, like, we have to go for a test. Like, you're not allowed back because we're bringing them back for a test. The other thing is not having ID, which is becoming more common. Also, like, they lie about their address or they lie about their age. They're not dressed appropriately, or maybe you've seen them before and they're dressed normally, but then when you see them the next time, they've got some fancy things happening and some fancy nails and fancy clothes, and they're dressed differently. They avoid eye contact often as well, always looking down, nervous around, like, people in position of power. If it's immigration, they're often very afraid of being taken back to their country, so they're very nervous and scared. Bruises and places that there shouldn't be. They often come in too with there's a higher prevalence of STIs and UTIs. And same with children with abuse, usually more abdominal pain, and more frequent UTIs as well. So those are some signs. Yeah.
Why do you think, from your perspective, when we talk about human trafficking, and I think a lot of people don't think of it being something local, why do you think it has become on the rise? Or
I blame a lot of it on social media. I think there's a lot of ways of actually luring children over social media, but also even the adults, like the dating, because oftentimes it'll start out as a Romeo thing where this guy, like, he's your boyfriend and he's providing you with all this nice stuff, and they think this is great, and then all of a sudden it turns around to, well, you owe me. Or I've had another client, an example, I guess, would be a person that didn't see it as they were being trafficked. They didn't understand, because they were giving consent to the person buying the sex, didn't see it as trafficking, even though they would get beaten if they didn't do that. And they're not keeping the money, they're giving the money to the person that's abusing them. Once you sit down, sometimes it's not very obvious. Sometimes you have to sit down and talk to them, and then you get to know things from there. Another example, we did have, and there's a lot of vulnerable people too. We did have a client that was from overseas that came here for a better life and was at St. Clair College, and then she became involved with a man, the same sort of thing, Romeo thing. He started drugging her, and she did not return to school. Then she was on a text messaging, like what's that group called?
Dating app?
No, it wasn't a dating app. It's like a WhatsApp. And she was on the WhatsApp, and some random guy from Blenheim, I shouldn't say the name or the places where it was, but some random person came and picked her up, and then she ended up trying to commit suicide and came in with a false name, false age, all of that. And the reason why they caught that upstairs was that it didn't make sense to them that this was the age, and the name wasn't coming up anywhere, but yet she was a Canadian person, so why isn't her name? So I got involved with that as well, and she was just scared. She was scared that she would be taken back. So what other trafficking? It's another problem with trafficking too is the drug addiction, because the drug addiction sort of takes over their whole world, because all they care about at that point is getting their next fix. And they've been traumatized. Most often they're only using the drugs because they're being forced into using the drugs, and then they become addicted. And then once you're addicted, it's like that. It takes over your whole body. It takes over everything. So those clients were difficult to have. So what we did here was we created an algorithm for them. So if they disclosed that they were being trafficked, rather than us coming in as SADB and then releasing them, like getting finished with them, okay, see you later, you're out on the streets, because you're just handing them back to the trafficker, we would be able to offer them support by giving them withdrawal management and keeping them here overnight. And then the daytime hours, the SADB nurse could come in and provide them with a shower and food and STIs, like STI testing, whatever they prefer, while we call our resources in the community, and then provide them with a safer place after leaving. And then the second part was if they didn't want to stay, then we would ask them to come back during the daytime hours when there's another SADV nurse here. And if they didn't want that, then the very least we could provide them with those pens that have the scroll that's very discreet. Because we don't want to give them too much because they could potentially be beaten if they're found escaping. Just like victims of abuse, when they're leaving their partner, they're usually more at risk when they're leaving.
I'm curious, what do you, because you're seeing a vast number of cases for all different reasons, but what do you attribute it to? Do you attribute a lot of it to unstable kind of housing situations? Does the houselessness kind of rise within the encampments and vulnerability there come into play? Is it more the social, is it all of it? Like, just from your own words, where do you attributing a lot of it to, the cases?
So with sexual assault, like I feel like it's a few things. I feel, and that's where I feel it is gender based, is because like even when you hear about the groups of hockey players and things like that are like group raping women and they're getting off with it. Like I guess there's a few things that if I were to, I guess, categorize them, sexual assault I feel is not taken seriously, and I feel like even when there's complete physical evidence that this assault occurred, the punishment, like 9 months in jail and you're out, and then that woman has now been re-traumatized because he's out and she has to worry about her safety. I still don't feel women are being believed. I think that, and what bothers me too is coming in to do a sexual assault evidence kit, we're using speculums, like we're putting swabs in intimate places where they've just been violated. It's not a fun process. So when people ask me, well, do you believe? Yes, I believe them. I believe them 100%. But I don't believe necessarily everyone else does. And when it comes down to the justice system and what a woman has to go through in order to, like, so you go to court, you have to tell your story, and you have to tell your story multiple times, over and over again. And then you go through a rape kit. I have to worry about STIs, and you have to go on medications that can make you sick. And then you go to court, and then you do your pre-trial, and then they say, okay, you got enough evidence to move forward. So then you go to the other trial, retell your story again to a bunch of people with him sitting in the courtroom and family of his sitting in the courtroom. It's just, the process is horrible. And then at the end, if you find out either like charges are dropped, which makes that person feel, well, then I wasn't believed, or charges were laid and at least they could say I was believed, but then if the sentencing is like 9 months, that doesn't really say much for what occurred, because that woman's going through constant therapy afterwards to try to get help for this. Like, so I really feel strongly with sexual assault that it's not taken seriously. And I feel like it has to come from a higher level to change things. I feel like it's legislative. Like, we have to take the crime more seriously, and we have to believe more women that this is happening, because it's not a fun process to go through all this. So that's my opinion on sexual assault. Domestic violence, I feel there's a combination of things. I feel it's getting worse because I do agree with the poverty, the families, the drug addictions, the encampments. Sexual assault too with the encampments, because people are more vulnerable. But I feel like drug addiction has gotten worse. Poverty has definitely gotten worse. For a family to live right now, it's a lot. And I feel like that builds frustration in the family, and then it becomes violent that way. But I also feel, and again, I feel seeing more immigration and cultural things. I think that's also increased as well in our in Ontario anyway, with domestic violence as well, because they feel that this is okay to hit your spouse. And I feel like it's harder for women to leave now because of the financial problems and the burdens and having children and wanting the best for their kids, and being believed too as part of that. And then with human trafficking, I think, because I blame social media a lot, I think it's very easy for these people to get lured in to something that they don't really understand, especially with younger people. With the adults, I think drug addiction has a lot to do with it as well. Yeah, it's a whole combination of things, I think. And I think that's why when I think of prevention, instead of always educating women on how to protect ourselves and how to do this and how to do that, and when you go to a bar, cover your drinks. Like, it's sad that we have to scare our, like, friends and family when they go out as women, but yet the men we're not saying anything to. So I think, again, it comes back to educating our young youth, men, like males and females, about consent and about healthy relationships and about drug addictions and treating people equally and respect. Yeah, I don't know. I don't know what the answer is, but I think that what we're doing so far hasn't worked. So I think we have to look at educating the men and women. Like, I think both, but at younger groups. And I think that's hard too, because now all of a sudden, I know the sexual assault domestic violence team lead before me was in, and she was in it for about 17 years, was in the schools, but then they stopped her from coming. And now they say the content is too much. However, I think they are ready for the content at younger ages. Yeah.
It almost needs to be too much to
Yeah.
make an impact.
Yeah. I think it's sad. But I think that we all have to talk openly amongst our youth right now and just tell them this is what's right, this is what's wrong. Our young boys, talking to them about healthy relationship, and our women too, like the young ladies, because that's part of the problem too. If they grow up in a house that isn't a healthy relationship, they don't know any different. So I think educating them as well that this is what a healthy relationship looks like, and like you say, we're strong, and go, you could be anything you want to be, kind of thing.
Could you tell us some of the ways, even if you can't be in the school, some of the ways you feel it's important to get out in the community and share information and awareness?
Yes. Well, for prevention, again, I would say consent. Describe what consent is. Describe what a healthy relationship looks like. Respecting each other's bodies. No means no. But when it comes to post, so you've been violated, this is what this is where you could come for a safe place, and you can come to the emergency department. You don't have to wait in the emergency department for hours upon hours. You're brought right back. You will be believed, you'll be listened to, you'll be cared for, and they will provide you with more resources in our community to help provide wraparound services. One of the things I do, like with police or with other organizations, is talk about what services we have, because I don't think a lot of people know about us. I did not know about us having this before I had started in this position. It wasn't really talked about a lot. So I think talking about our services and what we can offer people and making them feel comfortable to come in, that they're not going to be, nobody's going to push them into talking to the police. Nobody's going to push them into talking to their parents. This is just a safe place to come and get help if need be.
So I know we saw you at, some of the footage we have is at Wallaceburg Hospital. I think there's been a couple, or I assume there's other kind of day fairs, or maybe you take your setup and go to other establishments. Could you tell us a little bit about that, about kind of getting
some of the opportunities you do to go out in the community, different events or engagements that you participate in?
Okay, so for the anti-human trafficking, February 22nd, is World Human Trafficking Day. And we did set up booths with Women's Center and our coalition, and as well as myself, over at St. Clair College. We try to get out to fairs and things like that, set up booths together, and we're usually all together too, so that the community members know maybe it's not us that they need, maybe they need victim services for something, or maybe they need the Women's Center and only the Women's Center, the Sexual Assault Crisis Center, like House of Offer Scene. We just try to set up booths with any event we could come to. May 31st, we're doing, thanks to the Chatham-Kent Sexual Assault Crisis Center, doing the funeral procession. So getting the word out that way. I was asked to speak at a flag raising event with the mayor at the Civic Center and say a few words about sexual assault and what we do here to help victims. I think I think if I could get one thing out or one message out to people is that they're not alone. So when they're feeling really alone and isolated, they do have somewhere to come that's safe. And again, I can't stress enough because nobody really likes the emergency department. It's no offense to the emergency department. It's just not a fun place to be. And oftentimes you have to wait for hours and hours to get in. You don't have to, we are separate from the emergency department, so you don't have to wait hours. Yeah, I guess that's about it.
Yeah.
For
I was just gonna say, well, one question is, doing this type of stuff, and there's a lot of heaviness and a lot of dark moments, and how do you find the joy in the work you do? What are some moments that you've experienced when you're like, this is why I do what I do. Like, this is when it mattered. This is what makes me feel good about it.
Some moments are when I can find out the end result. I don't always find out the end result, but if I can find the end result, I've had a victim come to me and say thank you. Your help, like what you did mattered. It's, I guess, knowing that at that moment you're helping them, you're giving them a little bit of reassurance when they leave. They feel that they've been listened to, believed. So even when I don't find out the outcome, just kind of knowing that I'm there to help them on the worst day of their life. And then hopefully when they leave, they feel a little bit better about themselves and about what happened. And hopefully they leave with more information and knowing that they're not alone, that this happens often, unfortunately. Yeah, and then as far as doing things to help me, like to help for vicarious trauma and things like that, it's talking to other partners. My family is like my foundation, so my husband, and he's very strong and supportive, and my kids, my grandchildren are very good therapy because they're just so happy and they're so fun. And then gardening and baking. I love all that stuff. So
So, overarching question, the project is called This Women's Work. That expression holds important value to us, of what it means to us. That's why the project's been titled that. It's sort of a reclamation of what that expression means, women's work. So we're asking each person we're interviewing, when you hear women's work, the expression women's work, what does that mean to you?
What comes to mind?
That's a tough one, actually. Empowering. I guess the first word that comes to mind is empowering. Empowering other women. I think that women have to empower other women, and I think that's part of the work that we do as an organization. Like all of our organizations, is try to empower other women and build them up and make them strong again. Especially when if they've been told over and over again that they're worthless, that they start to believe it. So then making them feel like, no, there is hope and you can get better. And yeah, I guess that would be what comes to mind with that.
Yeah. Perfect.
And then, we're also asking, what do you think in relation to like what women's work meant for your grandmother and then your mother, what it means for you today, and
Housework.
what you hope it means for future generations?
I think my grandmother and my mother would say, yes, that's housework. Like, that's your woman's work. That's what you do. I think as we move forward in generations, and I'm noticing it with my one son right now, who is just, his wife has started working weekends and things like that, where he's now in charge of the kids. It's put a little stress on him, but I think he's understanding that, what did your dad do? Because one thing with my husband and he had to step up because I was working shift work. So I think now a lot of that has changed, but definitely my grandmother and my mother would say a woman's work is in the house. Even when I was doing nursing, like, she'd say, poor Ted left alone, I'm like, no, he's fine. He's fine. He can manage himself, and he does. And he, the kids are always fed and taken care of. Yeah, we talk about that quite a bit, actually, where nowadays that typical woman's work is not what it used to be. So we can do pretty much anything that men can do. So, yeah, I think women's work today is anything they want it to be.
Thank you for listening to another episode of The Sister Strain.